Hey, thanks again for watching. Today I'm just going to let you know basically what my options were, my risks, and then kind of where I'm at right now. So I should get you caught up to real life time. Just keep in mind watching this that there are two types of BRCA 1 and 2, and so I'm specifically talking about 2, and I know very little to nothing about 1. So they are very different, and treatment and options are different. For BRCA2, basically my lifetime breast cancer risk goes from 12%, which is normal risk, to about 69% chance of getting cancer over my lifetime. The risks really go up as you get older, so once you hit 35, then your risk percentage really shoots up for BRCA2 again specifically. And then my risk also goes up for ovarian, uterine, skin, pancreatic, and if I had a prostate, my risk for prostate cancer would also be higher. So all pretty significant things. Basically for all of the other stuff, for like my uterus and ovaries, once I'm done using them, I'll get them out, is what the oncologist basically said. But breast cancer is a very real threat. Pretty much now. My mom's cousin was diagnosed in her 30s. I'm not really trying to fuck with it. So I need to do what I have to do to be preventative and be safe. And here my choices were given to me. So my first choice, as with anything like this, would be wait and see. I can do essentially nothing and just keep an eye on things. As my surgeon put it so eloquently, it is early detection, not early prevention. So I'm watching to make sure nothing changes and nothing goes wrong, but I'm not doing anything to stop something from happening. So at 27, that's a very real option and something that a lot of people would do because all of the other things are pretty aggressive, and my risk isn't quite as high as it gets yet. So it is a choice. What that looks like would be an MRI every year, and then once I hit 35, I would alternate a ultrasound and an MRI every 6 months. Breast MRIs suck ass, by the way. Super hurts. My bad shoulders from volleyball. I struggled a lot with it, so not looking forward to having to do that again when I do, but it is what it is. So, just of note. Secondarily, an option that I know exists but wasn't really given to me a lot because of my age at this point is a drug called tamoxifen, which I don't even know exactly what it does, but it is a choice as you get older because it works against, maybe, I don't know, the estrogen in your body to help kind of prevent those tissues from mutating. So even for my mom, the oncologist said, meh, you could try it, not so great. So, and it sounds like a pretty shitty drug to be on for a long time because no one has suggested that I take it for the next 20 years or anything like that. So that brings me to the third and probably most aggressive preventative option would be a bilateral mastectomy. And that is to have all of your breast tissue removed, and then they go in and reconstruct with implants. So that is what I'm doing. On May 30th, I will have that surgery. May 30th is also my birthday, so think nice things for me on that day. Basically what that looks like is a general surgeon goes in and takes out all of your breast tissue. I've been lucky because I'm not sick or anything at this point, so I should be able to keep my nipples. Basically they'll go in through the bottom and scrape everything out. And then later a plastic surgeon will go in and reconstruct. So it's going to be terrible. I shouldn't say that. It's going to be terrible. So that's what I've decided to do, because I'm not much for wait and see, knowing that I was so stressed waiting for my results for the genetic tests and MRIs and all of those things. I will literally go bald of stress trying to worry about having cancer all the time. So just also remember, if you know anyone, if you are someone dealing with this is a really big, big life-changing decision. And what I'm doing might not be right for your loved one or your friend or your cousin or yourself. You have to really stop and think. And I am thankful for the 6 weeks that I had waiting for my genetic test, because I really had time to research and to think about what my life would look like in whichever direction I chose. So just remember that. It's a super personal choice. I'm super freaked out. To have your breast removed at 27 is a big deal. I always wanted a boob job. This was not quite how I expected to get it. So, we'll figure it out though. So if there's anyone going through this or whatever, or knows someone going through this, or is just interested at this point, I will show you everything you want to see. Viewer discretion advised on some of my posts, I'm sure. I want you to know what this looks like so that if you're using this to make a slightly informed decision, then you can see another perspective. It doesn't sound like it's going to be very fun, but it takes my breast cancer risk to 3%, which is significantly less than even the general population. And I like those odds a lot better. So that is my plan. That's where I'm at. I will post again either a video or written post just to kind of let you know what it's like to meet with the surgeons, some tips dealing with insurance and all that kind of shit, and then some like small tips and just side things that you should really think about that you might not have before you go see doctors or anything like that. And then I'll post some vacation pictures in the middle. And then I will post as much as I can during my surgery period, pre-op and post. Thanks so much. See you soon.